Again, reading the last line here. The organism causing the above condition is destroyed by which one of the following immunological process? We have a 9-year-old girl who presents to the clinic with chief complaints of a swollen eye and a sinus infection for 4 days. She complained of left nasal pain prior to these symptoms. The patient noticed that the swelling and redness of her left eye has progressively worsened. It has been difficult to open her eyelids, and she complains of diplopia and pain during ocular movement. The visual acuity is 20 over 20 in both the eyes. Intraocular pressure is 23 and 14 in the right and left respectively. The test results for the complete blood count, ESR, CRP, are as follows. CBC results look like, so basically this will be given in a particular format. I'll ask the review team to change it. Okay, so we have leukocytes 18,000, neutrophils 80%, lymphocytes 14, eosinophil 1, baso 0, monocytes 5, HB is 12, ESR is 65, and CRP is 4.6. Okay, so this girl, if I'm not wrong, has orbital cellulitis, which is definitely very painful. All right, it's an infection of the soft orbital tissue posterior to the orbital septum. Most common pathogens are here definitely a deadly organism such as Streptococcus and Staph aureus, Pseudomonas, Entero, Klebsiella, Haemophilus. They're always the secondary organism, but remember it's Staph and Strep, which is the most common organism causing orbital cellulitis. All right, 90% of cases occur as a secondary extension, right? Because directly infecting the eye is not very common unless you have an obvious injury, like some foreign body has gone into your eyes, some piercing or penetration injury or a blunt trauma, because of the collection of the blood, which becomes a nidus for an infection. Other than that, it's not very possibly causing primary infection. So most of the times it's your secondary infection that comes from your nose, sinusitis. So it spreads, right? Now, phagocytosis is what? It's a consumption of opsonin tagged pathogens on necrotic tissue. Pseudopods extend from leukocytes to form phagosomes, which are internalized and merge with the lysosome to form your phagolysosome. The oxygen-dependent killing happens in these, becomes the main mechanism, correct? Now, I think there's a picture in your first aid which clearly shows you how the whole oxidative killing happens. Take a look at it, it's very beautiful. This is what makes you appreciate human body, right? It's very intricate and very, very, very cool to learn, okay? So learn the oxidative killing mechanism, because there are a few of your deficiencies which involve around oxidative deficiencies. Okay. Now, cytotoxic T cells, they are very popular, which kill virus infected or tumor cells because they go in by the release of cytotoxic granules which contain preformed proteins like perforin, granzymes, and stuff like that. Now, activation, we just learned it's your apoptosis. Will not read it again. NK cells are components of the innate immune system. They use perforin and granzyme just similar to your cytotoxic T cells, and by doing so, they induce apoptosis. That's how the end killing happens. Opsonization involves a process of tagging the antigens, making it tasty basically for their body cells to eat it up, right? For your antibodies to recognize by the immune cells. And antigens that are opsonized in the blood are often taken out of circulation by macrophages in the spleen, right? So that's why spleen is important. That's why macrophages are important. Now, phagocytosis is basically engulfment. We learned that, enhanced by opsonins, which is IgG and C3b. The leukocytes form phagolysosome, which help in degradation. Right. So one more thing what you guys should remember is there is a table in your first aid which gives you specific functions of complement, immunoglobulins. You should go through it. You should know it from top to bottom. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.